Today I am going to discuss anti-anxiety drugs. So before opening the pharmacology, let's talk about a patient. So a 30-year-old woman comes to the hospital. So physically she looks healthy, her blood pressure is normal, her blood sugar is normal, her ECG is also normal. So yet she says something very interesting. So doctor, I feel worried all the time. So I cannot sleep properly. My heart beats very fast. I always feel something bad is going to happen. So now the question is, where is the problem? So the heart is normal, the lungs are normal, the blood tests are normal. So actual problem is in the brain. And that brings us to anxiety disorders. So anxiety is not simply fear. Anxiety is an excessive feeling of worry, apprehension, tension, and nervousness. So that continues even when there is no immediate danger. Now, I want you to remember one important point. So, not all anxiety is harmful. In fact, a small amount of anxiety is useful. So, if we have an examination tomorrow and you feel absolutely no anxiety, you may not even open your book textbook, right? So, a little anxiety motivates us. The problem starts when anxiety becomes excessive and starts interfering with normal life. At that point, treatment becomes necessary. Now, let us move inside the brain. So, the brain contains billions of neurons communicating through neurotransmitters. Among all neurotransmitters involved in anxiety, so one neurotransmitter deserves special attention. That neurotransmitter is GABA. So GABA stands for gamma aminobutyric acid. I like to describe GABA as the natural brake system of the brain. So think about a moving car. A car needs an accelerator to move forward, but it also needs brakes to prevent loss of control. So the brain works in a similar way. So excitatory neurotransmitters increase neuronal activity and the GABA slows neuronal activity. So when GABA activity is adequate, the brain remains calm and balanced. So when GABA activity decreases, the brain becomes excessively active, leading to anxiety, nervousness, and sometimes even seizures. So this understanding gave scientists an important idea. So instead of directly fighting anxiety, why not strengthen the brain's natural braking system? That idea led to the development of one of the most important group of anti-anxiety drugs, the benzodiazepines. So when you hear the term anti-anxiety drugs, the first group that should come to your mind is benzodiazepines. For example, include diazepam, lorazepam, alprazolam, and clonazepam. So these drugs become popular because they work quickly. This is very important and clinically. So imagine a patient experiencing severe anxiety right now. The patient cannot wait for weeks. The patient needs relief today. Benzodiazepines can provide that rapid relief. Now let's understand how they work. So normally GABA binds to the GABA A receptor in the brain. This allows chloride ions to enter the neuron. As a chloride enters, the neuron becomes less excitable. So the brain becomes calmer. So benzodiazepine do not replace GABA. Okay? They do not directly activate the receptor. Instead, they make GABA work more effectively. So in simple words, benzodiazepine help the brain use its normal calming system more efficiently. As a result, anxiety decreases. So once GABA activity increases, several effects become visible. First, anxiety decreases. Second, the patient becomes calmer. Third, the sleep improves. Fourth, skeletal muscle become relaxed. And fifth, seizure activity may be suppressed. So this explains why benzodiazepine have multiple clinical use. The most obvious use is anxiety disorder. However, these drugs are not limited to anxiety because they calm the brain. They are also used for insomnia. because they lack muscles. They may be used in muscle spasms. Because they suppress abnormal electrical activity in the brain, some benzodiazepines are used in anticonvulsants. And because alcohol withdrawal produces excessive CNS excitation. So benzodiazepines are useful during alcohol withdrawal management. Now every pharmacological effect comes with a price, right? If a drug calms the brain, excessive calming can produce unwanted effects. So the most common adverse effect is drowsiness. The patient may complain of excessive sleepiness. Some patients feel dizzy, others feel mentally slowed down, and elderly patients may become confused and may even be at a risk of falls. Therefore, these drugs should be prescribed carefully. So this is one of the most important examination topic, right? So initially a patient may respond very well to a particular dose. After prolonged use, the same dose may produce a weaker effect. This phenomenon is called tolerance. So another concern is dependence. The patient's body gradually becomes accustomed to the drug. If the medication is suddenly stopped, withdrawal symptoms may appear. So these symptoms can include anxiety, tremors, sweating, insomnia, and in severe cases seizures. For this reason, benzodiazepines should never be stopped after prolonged use. Okay, thank you.